Welcome to Victim to Victory, the Personal Injury Playbook, the podcast to navigating the complex legal system after an injury. We bring you the expert insights and guidance you need to navigate the legal system with confidence, help you make informed decisions, and get the compensation you deserve. Don't let insurance companies take advantage of you. This podcast is designed to empower you with the knowledge you need to protect yourself and your loved ones. So sit back, relax, and let's start exploring the world of personal injury law together.
Dr. Nirav Shah is a highly experienced neurosurgeon and the medical director of Princeton Brain and Spine, with a deep commitment to providing compassionate and personal care to each of his patients. Dr. Shah has established himself as a trusted expert in the field of neurology. Good afternoon, doctor. How are you today?
Good afternoon. Thanks for the time.
I know right before we got on here, we were talking a little bit about your Eagles and how they just fell a little short this year, but had a great year.
It was a great year, very entertaining. Just couldn't get over the hump at the end, but I have a feeling we'll be back.
Well, tell me a little bit about Princeton Brain and Spine and what your specialty is and what you do as a neurologist.
Yeah, I'm happy to. Again, hello, my name is Nirav Shah. I'm a neurosurgeon. I basically specialize on the brain and spine. My particular practice is called Princeton Brain and Spine and Sports Medicine. It's a multidisciplinary practice focusing on disorders of the brain and spine. Everything from congenital disorders to traumatic injuries. And we have a very high emphasis on traumatic injuries of the brain and spine, particularly because of a lot of the training most of our doctors have undergone. We've gone to a number of training facilities during our residency where we had extended experience with injuries to the brain and spine. And when taking that interest and that skill set to the community. Our group is the largest neurosurgery group in central New Jersey. Collectively, we cover all of the major hospital systems in central New Jersey. That includes Capital Health Systems, which is a trauma center in Trenton, New Jersey, where patients with severe accidents to the brain and spine often come. Also, Princeton Penn Medical Center, Central State Medical Center in Freehold, New Jersey, and Hunterdon Medical Center in Flemington, New Jersey. We basically cover those hospitals all the time. So we see our fair share of accident victims, unfortunately, on a frequent basis. As a neurosurgeon, my goal is to see patients with brain and spine problems and decide whether or not surgery would be appropriate now or in the future. And I'm there to guide people, help them to explain what's going on, and provide a certain expertise that others don't have in order to determine the best course of action.
What are some common types of brain injuries that you see in personal injury cases? And what kind of effect do those injuries have on people's lives that suffer these injuries?
Well, brain injuries have a wide spectrum. Things that are surgical, where it's obvious, where someone has a direct blow to the head and they've developed bleeding. And those are cases where I'll have to come in the middle of the night often to perform brain surgery, to evacuate bleeding, to reduce pressure in the brain. Those are more catastrophic injuries. And then I also deal with what we call concussions that are non-surgical. Neurosurgeons, even though we do surgery, still deal with non-surgical issues all the time. In fact, the head of the concussion committee in the NFL is a neurosurgeon, someone I know. So neurosurgeons are widely accepted experts, ourselves included, in brain injuries, spanning the entire gamut, whether it be head injuries from a concussion, where there may not be a obvious external injury, versus something that requires surgery, where it's more obvious.
How can a traumatic brain injury affect somebody's cognitive abilities?
Well, cognitive ability is the ability to think and plan and function in what we call an executive manner, being able to get through your day, making decisions, having emotional contacts with family and friends, and being able to navigate yourself from point A to point B. When an injury occurs in the brain, that type of navigation, that connection to do so tends to get scrambled. I often tell my patients, if you think about your cell phone and you fall on the floor and the cell phone doesn't work properly, it may look normal to you, but it's not functioning appropriately. So at a cellular scale, something you can't see, there's a disconnection in the brain from one lobe to another. And that will render someone with difficulty thinking, with memory, with speech, with headache, with emotional changes that have profound and often progressive effects over time.
So what type of therapies can be helpful in treating these cognitive issues?
Well, our practice has a lot of these types of therapies. First and foremost, we try to get those patients in as quickly as possible. There's no time like the present in terms of a brain injury. We like to get these patients in the closest to the injury so we get the best exam. So a neurologist or neurosurgeon or a physiatrist, rehabilitation doctor, or sports medicine doctor are all capable of rendering an opinion about a head injury and evaluating a patient. Then we determine if imaging is required, such as an MRI or CAT scan, if we're worried about a physical exam finding. And then we might tell a patient either to rest and come back in a few weeks and take some time off of work or school, take time off of sports, or we might initiate treatments that we offer here at Princeton Brain and Spine, such as balance therapy if they have balance issues, neurological care if they have neurologic issues, pain management if they have severe neck pain going into the head, where injections therapy may be helpful, even Botox therapy to relax the muscles. Those are things that we provide, and it all comes down to tailoring it case by case. You can't have every patient undergo the same treatment algorithm when they have an injury. It's a case by case basis.
And is that why it's so important to have a multiple disciplinary practice and approach to each patient?
It is. Having a combination of neurosurgery, neurology, sports medicine, physiatry, pain management, vestibular therapy, which is the balance therapy. Those are all critical components in healing a brain trauma.
Now, going over to a spinal cord injury, what are some signs that someone might have suffered a spinal cord injury, and how does the severity of the injury affect the potential for recovery?
Well, spinal cord is your neck and your mid-back. Then the spinal cord ends and forms nerves that go into your lower back. So when someone has a spinal cord injury, we always refer that to the neck and the thoracic, or cervical and thoracic. And when someone has a profound deficit, when they have weakness or sensory loss from compression of the spinal cord, from a slipped disc from trauma, or a fracture from trauma, or bleeding from trauma, they may require surgery. They may require aggressive physical therapy. They may require pain management. The first step is evaluating the patient, getting the appropriate studies, such as an MRI and CAT scan, evaluating that personally. It's important that the doctor looks at the films themselves, because they have to interpret that and perform what we call a clinical correlation. That's the difference between a neurosurgeon and radiologist. A radiologist simply sits in a room and makes a comment about an X-ray. A neurosurgeon not only comments on the X-ray, but evaluates the patient to put 2 and 2 together. And that's called a clinical correlation. And I think that's a very important part of the spinal cord injury workup. And then having a multidisciplinary approach with physical therapy, rehabilitation, physician, as well as pain management.
Are there certain types of personal injury cases, whether it be an auto accident, a construction case, a fall, that actually produce more neck injuries than others? And why are they susceptible from that type of injury?
I would say in a case where someone does not have any pre-existing condition, I see a fair amount of neck injuries with car accidents. I certainly see a fair amount with slip and falls and construction and work-related injuries. I would say as far as new injuries that occur to the spine, because of the sheer volume, I think car accidents are the ones that I see most of. But I also see them in other more catastrophic injuries, such as falls or work-related injuries and things like that. Now, if someone had a pre-existing anatomical finding that was not symptomatic before, they're more susceptible to an injury. And those are often seen in those types of circumstances. And so it's just really a case by case basis, but from the sheer volume of it, I would say the car accident victims are the ones I see mostly with these types of injuries.
What are the biggest challenges when dealing with spinal cord injuries?
The patients themselves and the frustration they're dealing with in terms of pain and neurologic deficit and timing. We want to evaluate the patient quickly. We want to get the appropriate imaging. We want to initiate the appropriate care. Sometimes that is conservative management with therapy and pain management. Sometimes it's right to surgery. So the frustrating thing is really trying to figure out what is best for the patient and then how to get there, and navigating through a system that is very difficult to navigate through when you're talking about injured patients. And when I talk about in system, I'm talking about insurance. I'm talking about coverage, because we want to get these people the care that they need and deserve.
And do the insurance companies battle you for the proper care?
Some do, unfortunately, and I think there is a rightful opportunity for them to present an opinion that it may not be related to an accident. But in a spinal cord injury case, I would say more often than not, they are more compliant with the treatment recommendations than if someone were to have a non-spinal cord injury case.
When it comes to determining the extent of somebody's injuries and the impact that it's having on their life, how do you work with personal injury lawyers and other members of the legal society to learn and provide accurate information to them?
Well, as a neurosurgeon, there's not many of us around, and they only graduate 2 or 3 per program every year. So we have a very certain and a unique expertise, both in the brain and spine. And in doing so, we do provide expert opinion to both plaintiff and defense attorneys in regards to injuries that occur. We are completely agnostic and receive referrals from both. If we are working with a patient who is represented by an attorney, we're happy to discuss the case with the attorney. We're happy to provide medical records to the attorney. We're happy to update the attorney on any treatment recommendations and pre-certification processes we have. And if we feel it is warranted and we can justify it, we are happy to provide an expert report detailing our treatment, the medical records, our exam, and prognosis of these types of patients. On the flip side, we also get referrals from defense attorneys, and we will objectively, just like we do with the plaintiff cases, evaluate the case and provide an expert opinion regarding causality, permanency, and need for future care.
What are some misconceptions people may have about spinal cord and brain injuries?
I think the misconception of it is because there's such a wide spectrum of symptoms that something is not a spinal cord injury, even though it is. So for example, if someone has an MRI that shows the spinal cord is being effaced, it's being compressed, but they don't have a neurological deficit, such as weakness or sensory loss, but they have clinically correlating pain, that's a spinal cord injury. And there's pressure on the spinal cord resulting in a manifestation of pain. Pain is a neurologic sequelae of an injury. So I think one of the misconceptions is really a spinal cord injury has to be someone who's paralyzed, has to be someone who is completely decompensated, requires around-the-clock care, cannot function, cannot work. Just like there's a wide spectrum of brain injuries that I treat, there's a wide spectrum of spinal cord injuries that I treat. And some have catastrophic injuries where they cannot walk again. Some can walk and they look like normal people functioning on a daily basis. But the one thing you cannot gauge is pain. Pain is not something one can gauge. And that is a manifestation of a spinal cord injury.
How can education and awareness help address these misconceptions?
It certainly can. Every time I see a patient, I try to educate them in regards to what they have. I do, we try to support that education with reviewing the imaging and providing our own training and experience in regards to these types of injuries. I think you have to be careful what you read on the internet because there's a lot of stuff that's relatively untrue, but referring to your treating doctor's website in regards to the treatment, the conditions they treat, often has a plethora of information in regards to spinal cord injury, how we treat them, and even advice on what to do with it. Ultimately, though, you have to have a trusted physician in order to get trusted advice and ultimately superior care. And sometimes that care is, sorry, ma'am, sorry, sir, we just can't do anything. You have a permanent injury and you're going to have to live with it.
Are there any emerging treatments or therapies or various approaches that you're excited about implementing?
Yes, at Princeton Brain and Spine, we pride ourselves to be on the cutting edge. I like to think that that's why we get a lot of the referrals we do from other area doctors. We pride ourselves on procedures because we're surgeons here, so we provide surgery. Procedures that, while they do have a permanent byproduct to a patient, whenever you do surgery, no matter what, there's permanent sequelae, permanent scarring, permanent limitations in range of motion, particularly if you put implants in. But the access to the body can be different. It can be less invasive so that the recovery can be quicker through smaller tubes rather than through big incisions. Just because someone does not have a big incision does not mean they don't have a permanent injury and permanent issues from surgery. It just means we've done a smaller access to provide less disruption of the muscle. The technology today allows us to do that. We also perform artificial disc replacements, which are become really exciting for us. A lot of patients don't want a spinal fusion because of the inherent limitations to range of motion and some of the byproducts such as bracing that have to occur. And we can offer alternatives such as artificial disc replacement that may have beneficial properties. Not everyone's a candidate for it. And then we also offer fusions of the sacroiliac joint. That's a side joint where the hip and the spine meet. That's often unrecognized in the injury population. Oftentimes, patients will have a car accident, for example. They may get rear-ended and their foot was on the brake and they had a forward flexion extension type injury. A lot of those forces get translated to the hip area. That hip is the sacroiliac joint, and that can get aggravated or injured. And then a fusion may be required in a minimally invasive outpatient way that can really change someone's life. And oftentimes when their MRI is equivocal, when the MRI is not showing a clear-cut clinical correlation, we can point to the sacroiliac joint as a problems area and we can have that fixed.
What advice would you give to someone, a patient, who sustains a serious brain or spinal cord injury and is struggling to navigate the medical and legal procedures?
Yeah, it is tough. I don't think anything in medicine is easy to navigate through, let alone injury type things. First and foremost, at least in my experience, there are a number of obstacles. The first and foremost is, how do you do a claim? How do you present this to the insurance company? Let's say you had a car accident. A lot of patients don't even know how to enter a claim to the car insurance and set up a meeting with the case manager or someone like that to help them navigate through the system. The second part would be the medical professionals. Because it's a difficult system and because you really require a significant back office to navigate through this system, a lot of doctors will not invest in that. And if that investment is not there, they'll shy away from treating these patients. So the access to these patients can be difficult. The third obstacle is the coverage. In New Jersey, we are a no-fault state, so it has to go through their car insurance. And often just going to the emergency room and the ambulance may exhaust the plan. Now what do? What if they don't have health insurance? What if they have insurance that a doctor does not participate in, such as Medicaid? So that is an obstacle to getting care. Those are the things that we see on a daily basis, preventing patients from seeking care on a continuous basis. And patients that do have attorneys that understand that patient care comes first and we'll figure it out later, those are the ones that are getting better care, because they will, just because I may get an attorney referral doesn't mean it is any less of a referral than from another doctor. I get referrals from lay people all the time. So just because it's from an attorney doesn't mean it's any less of a referral. We're just trying to help people here. And we want to help them navigate through the system so they get the best care possible to get them on their feet again. And if they don't have a problem, we'll tell them, look, we can't help you. It's not what it is. And we'll be honest with them and their attorney. But we just need to get them in. And I think those are the obstacles that I see, at least in the marketplace, preventing patients from getting the appropriate care. Sometimes they'll have an attorney and they haven't even sought care because there's no direction. They don't understand what to do. So, choosing the right person to represent you, I think, is very important. And then getting doctors that understand not only how to treat people the right way, but also to navigate through the system through their back office is also important.
Thanks, Doctor. Finally, what are some key things that personal injury lawyers should keep in mind when they're working with a medical professional, a neurosurgeon such as yourself, when they're trying to effectively represent a client?
Well, I think it comes down to doing exactly what I said earlier, right? Having the client's best interest at heart. And that starts with their care. Because once the care is superior and started on time, everything else follows. And I think having a relationship with physicians that understand the injury world, not so much because the doctor wants to get these referrals, but because at least my practice accepts referrals from everything. We accept all major insurance carriers, including Medicaid. We cover all of the hospitals. We see workman's comp. We see Medicare. We see major medical. We see motor vehicle. We see injury cases. So our goal is to provide access to all patients because we care about patient care. It's what we do. So I think aligning and understanding which doctors can do that based on their accessibility is an important concept. And I think, meeting with these patients and shepherding them through the process, is important too. I often get this thing, my lawyer told me to come here, but most of the time it's because they just haven't had the appropriate care, and I think it is important to be able to, you can establish trust with your client when you send these people to the right doctors, you send them to the right facilities. The people are not getting gouged and over-treated, but getting appropriately treated, and keeping an eye on the file to make sure that there are no red flags going on. And I think that's going to serve your clients really well in the long run.
Doctor, is there anything else you would like to add? Any form of advice you'd like to give to either a patient who's injured in an automobile collision or a slip and fall, construction accident, or the attorneys representing them? What is the advice that you could give to people involved in the personal injury realm?
Yes, well, I could say in state of New Jersey, at least you're not alone. When you have an injury and it happened at the site of work or happened as a result of a car accident or at some facility, and there's an injury there and you're concerned about liability there, first and foremost, you have to retain a good lawyer. You have to be able to do that. Because as I had stated, the insurance, the navigation through the system alone is difficult. And having a partner to be able to sort of help you get through that process is very important. And then you got to seek medical attention as quickly as possible. Oftentimes I see patients trying to deal with pain on their own. It's like 2 months before they start seeing doctors. I think if you're in pain after an injury, you should seek a doctor's opinion. Sometimes your lawyer will give you an advice on who to go to, but it's up to the patient to ultimately make that appointment. It's up to the patient to do their due diligence to make sure they're comfortable with their doctor. So it's not the attorney who's saying to go there, it is the patient. And I think as a patient, you have to be able to advocate for yourself, but having an advocate with an attorney is vital.
Doctor is a top neurosurgeon with Princeton Brain and Spine, one of the best surgeons on the East Coast. I really appreciate your time being here on the podcast of the Personal Injury Playbook. Thank you so much.
I appreciate your time. Go Eagles.
Go Eagles. All right, Nirav. Take care now, Doctor.
Take care now. Bye-bye.
Thank you for tuning in to Victim to Victory, the Personal Injury Playbook. We hope you found today's discussion insightful and helpful as you navigate the complex legal system. If you or someone you know suffered from a personal injury, don't hesitate to reach out to us at 1-800-489-0004. Our team is here to help take you from victim to victory. Remember, taking legal action after a personal injury is a critical step in protecting your rights and securing your future. So don't wait. Make the call today and let us help you fight for the compensation you deserve. We'll be back next week with more expert insights and information.
This podcast is intended for informational and educational purposes only and should not be considered legal advice. The content of this podcast is based on the laws and regulations of the United States and may not be applicable in other jurisdictions. Additionally, any information shared on this podcast is not protected by attorney-client privilege or any other type of confidentiality. Remember, this podcast is for informational and educational purposes only and should not be considered legal advice.